Hello, my name is Catalina Ramirez. I am a Master of Health Administration student at the University of South Florida, and I will be talking about the healthcare system in Colombia and how it compares to the United States. Colombia's healthcare system is a hybrid of the Bismarck and Beveridge models. The contributory system reflects the Bismarck model, and the subsidized system reflects the Beveridge model. The contributory system is supported by payroll contributions of 12.5% of a person's salary. 4% comes from the employee and 8.5% comes from their employer. On the other hand, the subsidized system covers those without steady income through public funding. All legal residents must be enrolled in an EPS where they can choose their insurer. This design embeds healthcare into the larger social framework, viewing access as a social right and a part of Colombia's broader strategy for equity and social protection. To manage moral hazard, Colombia uses a tiered copay system, where out-of-pocket fees are low and based on income. In 2021, these copays ranged from $1 to $9.80. It also limits unnecessary use to primary care gatekeeping and a standardized health benefits package. Selection bias is addressed by mandating universal coverage and pooling risk across both the private and the public systems. EPS organizations receive capitated payments, encouraging them to focus on population health, not just treatment. Notably, Colombia's healthcare costs are much lower than the US. In 2024, Colombia spent about 9% of its GDP in healthcare, while the US spent 17.6%. In terms of access, Colombia has a solid infrastructure but falls behind the US in availability of beds and doctors per capita. Patient satisfaction is also lower, with only 38% of Colombians trusting the system, while in the US, patient experience metrics are generally higher. Health outcomes reflect this gap too. The US has a longer life expectancy and lower infant mortality, although Colombia has a lower crude death rate, which may reflect demographic differences. Colombia's system is under pressure from internal factors like aging population and chronic diseases, and external threats such as vector-borne illnesses, corruption, and political tension. Still, there are several similarities to the US healthcare model. Both use electronic health records, advanced medical technology, and managed care principles like capitation. Lastly, both systems are shifting focus towards preventive care to reduce long-term burdens on the system. Thank you so much for watching.